I think another, whether it's a mistake or just a truth, is that there's a lot of distrust between patients and the healthcare system. And I think that, politically, there's problems in the healthcare system that make things hard to navigate. I think that there's been historically, particularly in minority populations, a distrust of healthcare and the way that we treat patients. And I think that that can sometimes be a major barrier to good communication at end of life. And just as we don't want to generalize about our patients and their families, we as healthcare providers don't want to be generalized about. So just because perhaps another hospital didn't handle something well, that doesn't mean that we're going to not handle something well. Or maybe there was bad communication with a team of doctors in the same hospital. Maybe the communication was bad before the ICU and all of these terrible things happen, and that happens. Not that it's right or wrong, but it happens. But once you get to the ICU, it's so important to have that therapeutic alliance with the clinicians. And I think that not being open to that is a real mistake I've seen patients and families make, because we are there to help. We're not there to make things worse or make things harder or to be negative. We're trying to help, and not being open to that causes a lot of problems, I think, within the healthcare dynamic. So sometimes the ideal dynamic between a patient and a healthcare provider, a camaraderie, a good therapeutic alliance, doesn't exist for whatever reason. Maybe there's there's problems that just can't be resolved. And so patients and families have options for that. There are always specialists called palliative care physicians that can help when there's a goals of care conflict, meaning that when the doctors and the families don't agree, sometimes it can be very helpful to have a palliative care expert come in and help clarify goals and values. It's not always necessary. You don't always need palliative care to come in and do that. Sometimes the ICU physicians are trained, we are trained to do that, and some people are able to do it more effectively than others. But if you as a family member feel that you're not getting effective communication from the lead physician, you can always ask for a palliative care consult. And those kinds of physicians can come in and not only help with the communication, but they sometimes will see things that the families didn't see in terms of symptom issues, or can make recommendations that the intensive care physicians may not have made or may not have thought of. And so it's always welcome to have more than one sort of brain on a problem. Certainly, if there's major problems, most hospitals have patient advocacy groups that you can call to say, I'm really just having concerns and having problems, and here's why. And then the patient advocacy group can help to forge connections, build bridges, and solve problems. For very severe ethical conflicts, all hospitals have some form of an ethics committee, which means that there are people that their role is to help establish bridges to help solve problems that involve ethical concerns. But all hospitals have some form of a committee that can help with these kinds of issues. And between those three things, the palliative care physician, the ethics consult service, and patient advocacy, usually major conflicts are able to get resolved.